Good morning, everyone. Thank you so much for joining us today. This is Michelle Mavison with Oregon Health Authority, and we'll go ahead and get started. Just as a reminder, for muting or unmuting is either the microphone icon or *6 if you're joining us by phone. We'll have people probably still trickling in, but in the interest of time, we'll go ahead and just get started. And again, just good morning. Appreciate everyone taking time out of your busy days and lives to come together. This, as a reminder, is regarding the Ground Emergency Medical Transportation Private Provider Supplemental Payment Program. And just again to note that this is being recorded. We do plan to save the recording and have that be made available after this meeting. So if there's anyone, colleagues of yours that aren't able to attend today but would be interested to know more information about this program, we'll make sure that that recording is available to everyone in a follow-up after today's informational meeting. And really the intention is to bring everyone together and have these, we have a series of informational meetings. This is the first of 3 in which we will provide information about the program and continue to provide information as we get ready for things as it's being implemented. So thank you again for your time and your engagement. This program really, the intention of it is to close the gap of the high costs of the life-saving services provided to OHP members and clients. And so this program is a supplemental payment program, meaning it's separate on top of any other reimbursement you would get for these services for advanced and basic life support services provided to OHP members. So this is a supplemental payment program in which we pull together funds and draw down federal funding, again, to supplement and close the gap on the what we know are high costs for these life-saving services. So thank you again for joining us. We'll go ahead and just introduce our team here at OHA that's getting this program operationalized. And I'll see if Nathan Roberts has joined us to kick off introductions from OHA.
Yes, hello everyone. Thank you, Michelle, for getting us started. My name is Nathan Roberts, and I am with the Oregon Health Authority. I'm a manager in the Medicaid division, and the transportation programs covered by Medicaid, the policy support for that is under me, and that would include this supplemental and the several other supplementals for that. So welcome and happy to be here.
Thanks so much, Nathan. And I'll turn it over next to Katie Brown, if you'd like to introduce yourself.
Good morning, everyone. My name's Katie. I am the provider tax analyst for the Oregon Department of Human Services and the Oregon Health Authority. I will be help administering and collecting the GEMT provider assessments along with the other assessments that I handle for the department.
Thanks, Katie. And Rick, I'll turn it over to you.
I am Rick Dowdy, he, him pronouns. I work in support of the program. I'm an analyst with the Oregon Health Authority, and it's been a good process to work together with Michelle and trying to make this happen. So nice to be here and nice to welcome you all here.
Thanks so much, Rick. And Sydney.
Hi, all. My name is Sydney McConnell. I use she, her pronouns. I am also working, I work in the Medicaid unit on some other things, but I'm here supporting Michelle, and you will likely see me copied or sending emails to you. So I'm looking forward to working with all of you.
Thanks so much. And my name is Michelle Mavison again. I work directly under Nathan within Oregon Health Authority on transportation programs, including ground emergency, also other emergency services, air ambulance, and non-emergency medical transportation as well. Previously in this position was Jenny Claiborne, who you may have engaged with and interacted with and got communications from early on within this program, and I am now the point person. So when you begin on this program, you would definitely be interacting with Katie Brown for the initial
And mine is taking notes for me.
rest
And
of our team from OHA. So happy to come together with you all. I've been with OHA 11 years now. I've operationalized some other similar programs, so really excited to get this program off the ground and started with you all. We've been working closely with Sabrina Riggs as well, and I don't know if you're with us, Sabrina, if you want to introduce yourself. I know a lot of you might be part of the Oregon State Ambulance Association as well, but we've been really partnering closely with Sabrina in this effort to get this program implemented. And then with you all, as the attendees are the identified, qualified, eligible providers for this program. So in the interest of time, I don't think we'll be able to go through introductions with all 2020 or all 22 entities. However, if you could put your name and organization that you're with into the chat, that would be great. And Sabrina, I don't know if you're on or if you'd like to just introduce yourself, as you've been a core part of the effort in getting this program implemented with us here at OHA.
Yeah, happy to. I'm Sabrina Riggs. I'm with the Oregon State Ambulance Association, and we worked to pass House Bill 2910 back in the 2021 session, and have been working really closely with the really great team at OHA. And we're really pleased to be at this position now where we're so close to implementation. I'm really thankful for all that work.
Yeah, thank you, Sabrina, for all your partnership and advocacy and support in this effort together. Really excited that things are happening finally. I know this has been a long-awaited process and program to get started, so I'm really excited that we're at the point that we're at. And as we move forward, like I said, there will be a lot of opportunities for engagement. This is the first in a series of 3 informational webinars, and as we go through, we'll have more detail that we share out, hold more space for question and answer. Today's is really intended to give you all the basics, and again, there will be a recording that you can share out far and wide as needed with any interested parties to really get to know the basics of the program and where we're at right now in the early stages of implementation and processes and things that you can do now to be ready for when the system's ready to fully process and have full activity going through. So there will be more opportunities down the line. We're developing a frequently asked questions document and a checklist for providers. So we'll start with some of the basics today, and I'll turn over to just looking at our agenda really quickly. Again, providing background and what the payment process is, the provider requirements, forms, due dates, and where we're at with it. We'll touch briefly on the quality measure, but we'll have more time to get into those details as we go through. And once you've absorbed today's information and you have that base knowledge and everyone's aware of the basics of the programs, like I said, we'll continue to dig in on details. So if you do have questions, please do put those into the chat, and we will probably take those back and follow up. It'll help us continue to build the frequently asked questions document that we'll have, and we'll hold more space for that at an upcoming webinar as well to really get into the details. But we'll start just backing up for a moment with the basics of this program. And as Sabrina said, that her and the association were really a core part of the House bill that forms this program, that is this program's established through, which is House Bill 2910 that was passed in 2021. That House bill requires Oregon Health Authority to operationalize this program for qualifying GEMT private providers, which you all have been identified as. Additional approvals that are needed with the federal level through Centers for Medicare and Medicaid Services They work to approve both sides of the program, both the coordinated care organization, managed care for CCO enrolled members of OHP, as well as the fee-for-service component of the program. It has both those, and we'll talk a bit more on some upcoming slides about the differences, but really a lot of the provider requirements and the processes will be the same, but just so you can understand where the approvals are coming from and how that works. We also have the administrative rules for this program that have been established. So there's a link here on this slide to all of those. And we have an existing GMT webpage and resources there that I definitely want to point you all to. And if you can visit that page and get familiar if you haven't already, it has an overview about this program, and again, a link to the House bill that establishes the program and the Oregon administrative rules that have been established, and some early on webinars and recordings. But we've also added a section. We have an existing public provider program, but there's actually a dedicated section now for this private provider program as well. So you'll see today's meeting and upcoming meetings to be able to join to learn more about the program. Like I said, as we gear up for full activity to begin, and it has both the fee-for-service and CCO aspects of it. And we will continue to utilize the web page as a place for just a central location where we'll continue to put a frequently asked questions document or any other materials or supplemental documents or information about the program as it gets implemented and ongoingly. This will be our central spot together. Of course, those will be emailed out and other communications about any materials or documents or forms as well. But just to make sure you're all oriented towards this webpage, because we'll continue to utilize it as a central spot for placing any pertinent information about the program. So again, as far as the fee-for-service side of this program, the way that CMS approves is through state plan. So that's state plan for all of Medicaid, which includes a section regarding transportation. And so for the fee-for-service component of this program, that's approved through a state plan amendment. We received that approval, and that's beginning operationalized retro back, beginning as far back as April 1st, 2023. That is approval that we get on the state plan amendment that is just a one and done approval. We don't need to resubmit each year. That'll be ongoingly unless we make any further changes to the state plan. So that one is set and going back as far as April 1st, 2023. And again, those related OARs to the fee-for-service side. And then meanwhile, on the coordinated care organization side of this program, that's also approved through CMS, but it's approved through a preprint, which is utilized for qualified directed payments that get passed through CCOs. So CCOs don't retain any of these funds. These are just pass-through funds that they'll run on capitation financial cycles with the CCO and pass through payment to the providers. So it's really a mechanism for them to pass through these qualified directed payments to the providers on the CCO side of the program. And that approval through the preprint is an annual approval, and it does need to be submitted and approved ongoingly, which we'll talk more about that in the future, especially as we gear up for the next preprint submittal. But that's approved right now as far back as January 1st, 2024, and through the end of 2025. We submitted and received approval for calendar year 2024, and then we've also submitted and already received approval for calendar year 2025 as well. But there will be an upcoming submission process in the fall that I will be excited to engage with you all on as we develop that preprint submission for CMS, which will be for the calendar year, the eligible period of 2026. So far we have approval through the end of 2025 for the CCO side of this program. And there's a few more requirements on the CCO side of the program as well, and we'll spend some more time here in a moment just talking about the agreements to form with CCOs, the attestation that would come to OHA for that, the federal requirement that we have around that, and how those get processed through CCOs, which is a bit different than the fee-for-service side, where it's a direct payment and has a different retroactive date beginning for the program. So just to kind of highlight those differences, even though they're both approved through CMS, but how those approvals work on each side of the program. And then just to run through the provider requirements, this is pulled out of the Oregon Administrative Rule 410-136-3372. So this is the general rule for this program, and this is the Section 3, which really specifies the eligibility requirements for a provider, which is to be enrolled as an Oregon Health Plan Medicaid provider, that you provide these ground emergency medical transportation services to Medicaid recipients that qualify, and that you're not publicly owned, because there is already a public GMT program. You cannot participate in both. So you have to not be a public owned or operated entity for participating in this specific program, which you all joining us today that have received the invite have already been identified as meeting these requirements. On the CCO side of the program, there is an additional requirement to be a participating provider and have a contractual agreement with a CCO for the date of services that qualify. So this would be the eligible period going back as far as January 1st, 2024, and through the end of, through December 31st of 2025. And so we'll talk a bit more about what that means. So provider agreements, we don't have any with OHA that you're required to do. We checked with our Department of Justice and made sure that it's sufficient, that you're already enrolled as a Medicaid provider. We are going to have a memorandum that will come out about that, as well as some rulemaking that we'll do, which I'll be happy to engage with you all in as well if you'd like to be part of the Rules Advisory Committee out of that process. But that'll really be to clarify and rule. Earlier on, we thought there might be an agreement needed with providers in OHA for this program, another agreement, a special one, but that won't be needed. So we are going to clarify that in rule, and there will be a memo that comes out, but just to make sure you all know that we've confirmed that it's sufficient as you're enrolled as a Medicaid provider, that there wouldn't be another agreement needed directly with OHA. However, on the CCO side of the program, there is agreements that would be needed between the GMT provider and a CCO. And that is between those two direct parties. OHA is not a direct party of that agreement. However, we will require just for an attestation for when those agreements are formed between the two parties, between the GMT provider and the CCO. And really that's coming from a federal requirement for providers to be considered a participating provider, as defined in the OAR that's linked here. So really that's contractual relationship with the CCO that would be needed. And we have created a fact sheet that's specific for this program about that, which I can pull up as well, just to show you all what I'm talking about. So that's a direct link off of, again, the GMT program page, and within the section for the private provider program, under the CCO component of the program, you'll see this fact sheet as well as the attestation form that would be used for this part of the program. And so the fact sheet will show you, oh, sorry, I meant to bring that up instead of closing it. So the fact sheet will really tell you a bit more about the program as well as the contracts with CCO. where that federal requirement is coming from for the provider to be considered a participating provider of the CCO, and the minimum requirements for what that contract would include. It's really intended to be flexible in type, so it could be a full-fledged contract or a memorandum of understanding. It's really between the two parties to decide what type of contract, but just to know that it can be flexible in type. It's really just to satisfy that requirement that you're considered a participating provider of the CCO, and it's all for them to be able to pass through the payment to the provider. So it's really just to allow for that pass-through payment from the CCO to you as a provider, making sure that you have it effective for the dates that are eligible and approved for this program. So again, going back to January 1st, 2024 through the end of that calendar year. You could also be doing the same thing right now for 2025, since we have that approval as well. It's based on the services that qualify, so the advanced and basic life support. And the contractual agreement with the CCO doesn't specify rates or anything like that either. And we've highlighted in the fact sheet exactly where the requirement for the CCO is coming from. They do have a section within their CCO contract with OHA regarding qualified directed payments. There's quite a few that they have through existing GMT programs with public providers, as well as other hospital programs and things where this directed payment model is used. So they do have a specific section in their contract, and I've already had a couple CCOs reach out. We've been communicating to them through CCO weekly newsletters and things to make sure that they understand this component of this program, that it is like other pass-through payment programs that they have existing already, and that this is another one that's being implemented. And so I've had some reach out and I've pointed them to this information, and they've found that to be very helpful as providers might be reaching out to them to get a contract in place. And on that point, there is a list of CCO contracts that you can utilize for contracting. We do regular reporting for these payments as well to let the CCOs know exactly how much to pass through to which provider, which amounts. So those reporting contacts at the CCO are available to you, as well as a list of folks that we've identified at the CCO that can help with you with contracting. So that's where this link goes to, and by each CCO, just the primary and additional contacts that you can reach out to for those contracts if you haven't already, as well as we've added the CCO's innovator agent that might be a resource to help if you're having difficulty connecting with a CCO in this. And then for OHA, the requirement is just once you have a contract established with a CCO, that you would provide attestation of that to OHA. So we have a form created for that, and those can come into us anytime. So if you already have contractual agreements in place with CCOs, you can go to this attestation form and fill it out and submit it to OHA. We'll spend a lot more time with that at our next informational meeting as well. So if you're having, any questions about how to complete that form or the process or when those need to be completed by, we'll have more details around that at the next meeting in June. And see if there's anything else I didn't cover with this. Oh, and one other nuance or point that's important to know is to satisfy the federal requirement of being a participating provider of the CCO. The minimum requirement for that is at least one. So you would have at least one agreement with a CCO in Oregon and one attestation that would get submitted to OHA, and that satisfies the minimal requirement for that federal participation requirement. However, that only satisfies an agreement you have with that CCO. and it really depends on the advanced or basic life support services during the eligible time. So during calendar year 2024, for example, it depends on the services that were supplied to that CCO's enrolled members. So if you have an agreement with one CCO, but during 2024, you had services that occurred with a member enrolled in another CCO, you would need to have a contractual relationship with that second CCO to allow for the pass-through payment. It goes back specifically to the services that were supplied and paid for. And again, this is a supplemental payment program, so it's separate from the reimbursement that you receive with a CCO for these services. But when you have those services occur and you bill the CCO just like you normally would, when those occur, it really depends on which CCO enrolled member it was with, for which CCO would be passing through payment to you as a provider. So if all of your advanced and basic life support services in 2024 were with your local CCO, then you would just only need an agreement with them. But we do want to put that disclaimer out there because it would be potentially worth having multiple contracts with multiple CCOs in case there's services that qualify for other CCOs beyond your most local regional CCO. We know that emergencies can happen anytime, anywhere, right? So there could be some that qualify that you would be getting a pass-through payment through a CCO that isn't where the most services occurred. It could be, just a few, but just to be able to have that pass through with that CCO, it depends on the services that were rendered to their specific enrolled members. So just to keep that in mind when you look at, the eligible time period, such as for calendar year 2024, and the advanced and basic life support services that occurred, for which CCOs those were with would help you identify which CCOs to ensure that you have a contractual relationship with to allow for the pass-through payment. And then also on the CCO side of this program, just to highlight, there is a quality measurement that's required. So this is out of Federal Code of Regulations requirement, and part of the preprint that's approved through this process. There has to be at least one of the goals or objectives identified in Oregon's state quality strategy that advance through this program. I'm not going to spend a lot of time talking about this today. We will cover this in a lot more detail at a future meeting, but I did want to at least highlight that that's part of this. So again, on the CCO part of this program, there is an annual preprint submission that needs to be submitted and approved by CMS, and that we have to do each year, unlike the fee-for-service side where it's just a state plan amendment, and once it's approved, it's done and it's in place. But for the CCO part of the program, we do have an annual process with the preprint submission and approval needed, and there is a quality measurement, which is the CARES Cardiac Arrest Registry, and we'll get a lot more into what that is and how you can help us advance these goals and objectives. We can also spend some time looking at Oregon's quality strategy in a future meeting, so we'll dive a lot more into this in the future, but it's nothing that you need to do right now. There's no action you need to take right now for us to meet this measurement within the program. It's something that we'll continue to look at and expand on and ensure throughout the year that we're advancing those goals and objectives and looking at those together in more detail. So we'll continue with that at a future meeting. But for now, I really wanted to focus in on where exactly we're at within implementation. And this pertains to both fee-for-service and CCO. So the entire private provider supplemental program that's being operationalized and implemented starts with an assessment and the quality assurance fee collection. So you would have received back in February email from Katie about the program, about the reporting aspects of this, and there was a letter with that as well. And then in just recently on May 13th, there was another notice. The initial communications in February let you all know that this was coming and that you would have another notice for when it's actually beginning the assessment process and for when information would need to be completed and submitted to Katie by. So the May 13th email as a follow-up from February really kicks off that process. And we have retroactivity beginning with the assessment and the QAF processing back for 2024. We still need to go back just for the fee-for-service side only further than January 2024 because that has approval going all the way back to April of 2023. However, for this initial activity, as we get everything situated in the system and as the activity begins, we're starting with calendar year 2024, which pertains to both CCO and fee-for-service qualified services for the program. And so definitely, if you haven't already, connect with Katie and take a look at that May 13th email. Basically, it signifies that, yes, OHA is now able to accept these payments from providers and kick off that assessment. There's a workbook, data template reporting form that was revised that Katie has sent out as well and is linked here and attached within your meeting materials. And again, the retroactivity to begin with, for us to start processing, we're looking at 2024 with a due date of June 30th. If you're unable to make retroactive payment amounts in one payment, we also ask that you contact Katie as soon as possible to make payment arrangements for that. And I'll just take a pause here and maybe even open the form. I don't know if there's anything else you'd like to expand on this with Katie, or if we want to pause and see if there's any questions specifically about this initial process, because that's really what is in play right now. So just to make sure if there's any support needed between providers and Katie right now for this process. So Katie, I don't know if there's anything else you'd want to add to that, and then we could just see if there's any pressing questions from folks. And again, we're building a frequently asked questions document that can include questions and answers about this form and the completion and this process. Yeah, I'll just pause there and see, Katie, if you have anything to add.
Just the only thing that I would like to reiterate is the very last tab in the workbook is the calculation assessment form. Yes, thank you, Michelle. That form absolutely needs to come in with your payment so that we can go ahead and match the payment with the form in the accounting system to make sure that each emergency transport provider is credited accordingly. Otherwise, if we don't have the form, the payment may not get credited to your account appropriately. And then, of course, I'll be emailing asking where your payment is. So if we could please make sure that this form comes in with payment, that would be great.
Thanks so much, Katie. And the form was attached, included with Katie's email from May 13th. It's also available on the website, and it's also linked on these slides from today's meeting. So any of those ways you can access the form. It does have an instructions tab as well. And I'll just open it up for a moment just to see if there's any questions from providers or attendees specifically about this form or the initial process with Katie. I'm assuming, Katie, that providers, when they submit to you, they can submit the completed workbook and, of course, including that last tab, that last form with payment, or would it be that they would submit a completed workbook and then you would confirm the payment amount, or can you speak more to that as well, maybe?
So because this is a self-directed, self-reporting assessment tax, if the providers want to go ahead and email me the full workbook, that's, perfectly acceptable. We will need that information. And, they can do that prior to making the payment or after making the payment, whatever works best for them, as long as the information gets to where it needs to go.
Any questions about that initial process? And so, like I said, everyone's already been identified as eligible. We've verified that you qualify. We've looked that you had services during this eligible period as well for advanced and basic life support. And so we're at this point right now. We're at this point right now as far as the submission of this data to Katie and the collection of the fee, and that would be submitted to OHA. From there, we are waiting for system configuration to be completed. There's testing going on right now. And once that testing is completed, we'll have the green light to go forward through the system. And that's where we would take the fee collected into that established fund that the House bill directs us to have. And out of that fund is where we would take it through the system and draw down financial participating funds. So we would draw down those federal dollars, and that's what would be the total supplemental payments that would go out either directly through fee for service or a pass through from a CCO on the CCO side. But yeah, we're at that point of the data assessment, filling out the data form, sending in the fee, and that's what we will pool together to be able to, once the system's ready to absorb, to draw down the federal dollars for the total supplemental payment to providers. And just to highlight just all the partnership that our program policy staff relies on with Katie for the process that's happening now, but a lot of folks involved within financial systems and business systems to get this operationalized. So we're working with our partners to really get the system ready as soon as possible, and that's still being targeted for the end of June to be able to move forward and have the activity flow through the system. And we'll talk more in detail about what that'll look like. But I really wanted to focus now on the basics of the program, the qualifications, and then this initial process for the data assessment and fee. So I'll just see, I know we only have a couple minutes left, if there's any specific questions about this initial
Michelle,
process.
you have a question in the chat if you want to check that.
Is an agency able to opt out? So great question. The House bill that establishes this program states that you are required to participate if you are identified as qualifying and eligible. So that is a requirement per the House bill. There's other supplemental programs that can be voluntary, but this one is not voluntary in that way. So the CCO pass-through payment. They might, Krista, the contractual agreement with the CCO, and they have, CCOs have had to do this retroactively for other programs as well. So I know that they're able to do that and put it into place retroactively. That would be something to connect with the CCO directly on. Essentially, they at least need a mechanism, right, to get the funds to your provider entity. So that's really what the contractual relationship is all about. So you'd have to connect with the CCO to work out that piece. But typically, we would ask that there's the contractual agreement and attestation provided to OHA to allow for that pass-through, just so that that can pass through to you smoothly through the mechanism and manner identified between you and the CCO.
Sabrina has her hand up.
Oh yes, Sabrina, please.
Just to, I think Joan's question in the chat, I wondered if you might be able to share, Michelle, about the DOJ guidance that we got a little while back about volunteer agencies could go on a payment plan, and OHA would work with them to make the program work for them.
Yeah, we had gotten Department of Justice weighing in on that, and so there's two volunteer provider entities, and I can reach out directly after this meeting to connect directly with those folks as well and work with them and Katie. We did get approval for just the two volunteer agencies that have been identified to not have initial requirement to participate. However, that was quite a while ago that we had that, and now that we're operationalizing, we're hoping to do that with all the entities currently. I don't know, Nathan, if there's
And Michelle,
anything else
if I may, Michelle, so we aren't authorized to have the volunteer agencies not participate. The state law is very clear. Everyone has to participate, but we are able to have some flexibility on the timing and on, as Sabrina said, on a payment plan to ease you into it. And so to work with you in that regard to make sure that we're not disrupting too greatly, and that we can you can manage your cash flows and those pieces. But we will be very happy to work with each of you individually, but just know we can't waive you from participating. What we can do is help ease you into it.
Well said. Thank you, Nathan. And so, yeah, for the two volunteer entities, I'll reach out directly, do some targeted communications with you and Katie, and just to make sure that we figure that out for folks. But yeah, good disclaimer and clarification there that you are still required to participate as a volunteer agency, but we would work with you. And if a payment plan arrangement is needed, we should discuss that as soon as possible. Yeah, Cassandra, it's the gross receipts reporting tab. Is that tab specific to the quarter that you're reporting, or for example, are you reporting quarter two? Do you accumulate year-to-date information? Good question. And that kind of goes back to, you know, initially for 2024, we're looking at the full year, but moving forward, we will have it be reported quarterly. So I don't know, Katie, if you want to touch on that question from Cassandra, and keeping in mind that it's being handled a bit differently for when we're looking at all of 2024 versus in the future with quarterly reporting.
Correct. So quarterly would be based on the gross receipts, all gross receipts received during that quarter, whether it's a retroactive payment from the previous quarter or it's a quarter going forward. It's everything received by the agency during that quarter. For fiscal year 24, it would be a total accumulative gross receipts for all of 2024.
Thank you so much, Katie. Does that help, Cassandra? Okay, good. And good question. You know, this, like I said, will help us continue to build a frequently asked questions document too. So really appreciate the questions, and I think it can help answer that same question that another provider might have as well. And Joan, to your question in the chat, I would be your main contact person for the program. So please feel free to reach out to me, and you know, whether you're a volunteer agency or otherwise, anyone can reach out to me anytime. If you would like some one-on-one technical assistance, we can definitely come together individually as well. So happy to support however needed. We'll have these general meeting series, right, for information, and that can be shared out and is recorded and can be shared out. But if any agency out there is interested in some one-on-one technical assistance, we can get that scheduled as well. So please feel free to reach out to me, and I will put my contact information in the chat. and hopefully you have it already, but if not, I'll make sure that everyone has my contact information. And I see someone's hand popped up. I think it was Brandy, and I see someone typing into the chat as well. You're welcome. Thank you all as well. And I know we're just a bit over time. I'm going to go ahead and hang out, a bit longer if there's any other questions. Otherwise, we can stop and save the recording for now and make sure that that's shared out with everyone. And please, again, feel free to reach out anytime to our team. We just wanted to officially, welcome you all to the program and make sure that you know who we are and how you can reach us. And really excited to get this off the ground. Appreciate everyone's time and energy and on this, and really excited to continue on this journey together. But yeah, it's just wonderful to meet you all, and thank you so much for joining us today. And I'll go ahead and stay on the line a bit longer, but otherwise, thank you, and looking forward to the next engagement with you all as well. We will have a summary email follow-up from this and more materials to come. So I'll make sure, even in between this and the next informational webinar, that anything new about the program, any new documents that we add to the webpage, that you're notified about, and I'll share out in communications as well in between. So thank you again. Thank you all for joining. Yeah, Jamie, great question. Happy to help connect you with contacts at Trillium. If your initial outreach and contacts haven't worked out, we can also include the innovator agent for that CCO if needed. So happy to get more contacts for you with them. Yeah, just we have some additional reporting folks and people that if your primary contact from that contact list isn't, if you're not able to connect with them, we can definitely support you with additional contacts to connect with the CCO. Yes, Brandy.
I know you had talked about some of the fee-for-service payments. Is there any, and I apologize if I missed that. Like, I know the Washington one, they've kind of set the 325% of Medicare rates, right? Do we know what that's going to look like for Oregon? Like, if we're trying to, trying to do like the data analysis of this impact, right? Because I'm sure that's what our leadership is going to want to know. Can you speak any more to those fee-for-service payments, or how does that all break down?
Yeah, thank you. And more to come. We've been working with Sabrina and folks within OHA to assess. We know that we have approval for the fee-for-service portion of the program going back as far back as April 1st, 2023, that can be at a lower percent, so lower than the 5%. So we're working on that to identify what percent that would be calculated down to, potentially even something like 0.5. So we're still working out that. And then as far as the mechanism through the system that will pay directly to fee-for-service providers once, you've done the assessment piece and the QAS has been collected and put into the funds, ready for federal financial dollars to draw down and be matched with that for a total payment. We still are working out the details for how payments will go through fee-for-service. We know through CCO that it'll go on capitation cycles and be a pass-through payment through the CCO. But as far as the direct payment on the fee-for-service side, we still have some details to work out, which will be part of an upcoming informational meeting. And, as soon as we know more about that and the percentage that will go down to, we know we won't do the full 5% going back for fee-for-service. And that'll have its own unique rates as well. I don't know off the top of my head the percent of Medicaid, Medicare, but I can follow up with those details and even bring in some of our experts that designed this program to a future meeting that were, you know, a core part of that development in Oregon. I can't speak to it as well, but I can definitely bring experts to the table, and we can make sure that that's a topic that we cover in more detail in an upcoming meeting as well. So.
Would be great. I think I'm not alone in that concern as far as trying to do that data analysis. That way our leadership can have some kind of idea what that impact looks like. So thank you.
Definitely. Yeah, that makes sense. And yes, Jamie, you can email me directly and I'll go ahead and put my email in there right